Hello, everyone. I think we may have a similar issue with colleagues joining the wrong call. So massive apologies for that, and we'll make sure that that doesn't happen next time. But okay, so Di's in the background sorting all of that out. So I think what we'll do is we'll probably start, and I just want to welcome really Dr. Kerry Jones, who has joined us to talk about her work on Mind the Gap. So it's the flexible working conversation that we've been having this morning, actually, and it's really interesting and poignant research in terms of really what our workforce would expect from us rather than the other way around, which I think is the way that we perhaps have kind of approached this in the past. And I think we've started thinking in that slightly different way, having listened to Neil. So without further ado, I'll welcome Kerry to speak to you all. Thank you very much.
Okay, thank you, and welcome back. Hope you all had a good break. I bet you're all busy doing emails, I can guarantee it, but there you go. So if I could just have the first slide, please, that would be great. So I'm Kerry Jones. I have been a nurse midwife and working in workforce development for 41 years now in the NHS and periphery. I am actually 4 weeks away from retirement. And you'll be pleased to know that I have stayed longer by 5 years than I could have done. So I'm trying to practice what I preach. I'm currently Director of Education and Transformation for Nursing and Midwifery, working between Coventry and Warwickshire ICB and Coventry University, so working in very similar priority areas as yourselves. More recently, I was the National Senior Nurse Lead for Retention at NHS England, probably led there by the fact that I've been a bit of a retention anorak, researching retention of clinical professionals in the main since about 2013. And I'm going to focus my discussion on retention because we had Neil earlier who did some great work on attraction and transitioning people in. He touched on some important points around retention. So I'll probably dig a bit deeper and look at the reasons why these things are so important. And hopefully, because I've also heard this morning people talk about being overwhelmed because there's so much to do, hopefully to simplify the recipe a little bit, because actually the things that are important have been so for the last probably 40 or 50 years. And it actually isn't rocket science. But what we do know is it's not one single thing won't be the solution. It's a bundle of things that when you put them together, tend to shift the culture and make a difference in terms of people being attracted to you, but also staying with you, which, as we know, when you've talked through the data this morning, is absolutely critical. So if I could go on to the next slide then, please. I'll probably skip this one, but I'm going to talk about job satisfaction and how it relates to retention, but then also the things that drive that. So I'm going to go way back, if I could have the next slide. And don't worry, I'm not going to give you an academic talk because I've been a leader manager in this space for all my time. So it's about how we apply that learning to practical solutions. But I do want to go right back because actually Neil talked a lot about how we feel about work, and job satisfaction really is related to how work makes us feel. And all of the kind of researchers from way back recognise this. And they also recognise that the happier we are at work, the more engaged and motivated we are. So you know as well as I do, there's a new concept post-COVID called quietly quitting. And if you haven't heard of it, go on the YouTube and just type it in and you'll find some really good sort of talks on it. But this is about a change in relationship with work that all of us are having, no matter what generation. That COVID has kind of provoked us to reevaluate what's important in life and probably what we can do without. So I think, if we think about, when we had COVID, we went to really command and control because that was necessary. But I question how much we've let go of that in terms of how the NHS is currently being managed. And actually, that can sometimes have a real impact on how people feel about their work, because if you're being told what to do and not engaged in how to do it, and your, I guess, value and your professionalism isn't being recognised, you start to feel a little bit hacked off, quite frankly. And also, you'll totter along and just think, oh, I'll just go with it. You know, I've done this for X amount of years. I'll just keep going. And then one person says one thing and it's very negative. You know, you might have had a real busy day. You've had all the balls, you're juggling, and actually you've pulled the rabbit out the hat. But the one thing they want to talk about is the one thing that didn't go so well. And you just think, what's the point? And it's those little moments that we start to psychologically disconnect from work and the organisation. So when we talked earlier and Neil was talking about the little things, that's what I'm talking about here. So if we go on to the next slide. So what makes a good job? How do we design a job that keeps people motivated? Well, again, if we go back to the 70s, it still stands. That original research still stands. And I've done lots of subsequent research. And in a minute, I'll share with you the global literature, the current stuff. But pretty much the important things about a good job have remained the same. And, you know, this is a model, but basically what it's saying is, you know, when we're doing a job, we need to see that it's meaningful and that what we do is significant. So we need to see the end point of our contribution and how it all fits together. Really important is we need to have job control and we need to have a voice in how the work's done and also how to do the work differently to get the best result. And we know that, don't we, in our own areas of work, and clinical professionals and non-clinical professionals and all staff actually at their interface of work are the experts in terms of opportunities for improvement. Most of you will know from your own experience that the minute you start to lose job control, which is when people start to tell you what to do, and you keep this top-down approach, you feel stressed because you haven't got control. And that actually is what ultimately then leads to burnout. So job control is critical to job satisfaction. You need to have the tools to do the job, and that's resources, but also education and training. So you need to feel confident in what you're doing and also to be stretched to be even better. And also to know the outcome of your work, that you actually added value. And this is really about recognition. So people saying, you know, Reckers, you know, you really made a difference today. Thanks, you know, for coming to work. And what would we have done without you? It doesn't have to be big, huge gestures. And then finally, but I would suggest from all my work that one of the most important things is that social component of work. We're not robots. I think, you know, having gone through the 80s and the Griffiths approach to management and how we kind of evolved culturally in the NHS, we became a bit, couldn't bring ourselves to work and we couldn't be human. And I think we lost a lot during that period. So it's really important to have fun at work. And people go, well, should we have fun? But we're all, you know, we can do that professionally. But it's a critical ingredient. So I would say do not be afraid to inject the fun into the day-to-day work. So could I have the next slide, please? So if we look at the data, because I'm going to go on to talk about, you know, the changing expectations of work and career that we're seeing. But if we look at the national data, this is nursing midwifery, but actually it cuts across, and it cuts across health and social care, because what we're seeing is a very similar behaviour pattern in employees in all industries. But particularly for clinical professionals, what we see is key points of vulnerability. The first one being the first 2 years after people qualify. So this is when, you know, when I was at NHS England, this is where we track the biggest drop off. So people come in, they make all that effort to get through their education, to get their degree and register, but they don't stick around. And then what we see is that kind of instability until around the age of 40. Then things settle down, I guess, as people start to get mortgages and children and all these things that make you kind of, you know, stay in one place. And then, of course, especially in health, we see then it starts to become vulnerable again about the age of 55 when people start to become eligible to retire. So if we think that this early career and late career is our real sort of vulnerable period, if I go on to the next slide and show you, this is the profile in nursing and midwifery over time, but again, it's reflected across all professions. And you know, it was talked about in the introduction this morning. The makeup of our workforce, in greater numbers are these two risk groups. So you know, that should give us cause for concern, I think. You know, if these are our key points of vulnerability and more of the workforce is made up of this group, what do we need to do? So if I could have the next slide, please. So in 2013, I started a piece of work in Birmingham. I have to say I've worked around the patch for most of my career, but I actually live in rural Staffordshire, so I feel a bit of an insider here at this meeting. So we were worried because early career professionals were leaving. You know, we were just seeing that this same pattern that I talked about of vulnerability, and it was starting to cause concern. Can I tell you that at that time we had 17,000 vacancies in the country. We're now at like 45, 50, aren't we? And we thought we had a problem then. But so we did a piece of research with all of our early career nurses and midwives across the Birmingham students into the first year. And we did lots of things that I won't bore you with right now. But the bottom line is what we identified, that what we were seeing was the impact of changing generational expectations of work and career. And there's a whole kind of book on this, and it's an easy read, but it kind of helps you to understand why people might behave slightly differently to you or I, because we grew up at different times, we had different influences, and sometimes we're not just being difficult, we probably just don't understand where each other's coming from. So this work helps to kind of unpick that a little bit. So I'm probably one of the last of the baby boomers still working. What frightens me when I do the whole Mind the Gap talk and in detail on generations, there's fewer and fewer people put their hands up when I ask who's a baby boomer. And I feel like I'm going to be the last man standing soon. But we are, you know, just to cut a long story short, we are kind of really defined by our work. You know, we started at the bottom, we soldiered on, we know we're going to have a career for life. We were bruised and battered along the journey, but we kind of expected it in many ways. And we, you know, and we kind of are defined by our work. So we'll work weekends, evenings, all the rest of it, very unhealthy. The other thing is that baby boomers are known to have rebellious tendencies and not afraid to challenge, but I have a hypothesis that actually it's not that. You're so close to retirement, you don't care what you say anymore, and you don't care if anybody likes it or not. But that's just my perspective as somebody at that stage. And then, of course, Generation X, who kind of are glue in our system, aren't they? In terms of often they are the senior leaders and often sort of give up their own development and support to support others, but actually a really important group. What you do need to know about Gen X, if I pick anything out, it's that Gen Xers are quite independent and they like independent problem solving because they were brought up in the 70s when mom started to go out to work and divorce was on the increase, and kind of learned to stand on their own feet very early in life. So they don't need lots of stroking and stuff. They kind of, you know, just tell me what you need to do, be very clear about my objective, do not micromanage me, and I'll deliver a great result. Then the change happens. Generation Y and Z, which are now, obviously our Generation Ys are now sort of coming to their, you know, in 40. So they're kind of starting to get into that mid-career point. They are becoming the leaders. And I think what we need to know about Gen Y and Z is the way people were educated changed drastically when these guys, you know, were younger. And no longer were they like me, where, you know, if you put your head above the parapet, you know, you just didn't do it because it wasn't worth it. So you get your head down and, you know, you were kind of learnt your place and you didn't question and all these other things. But actually for Gen Y and Z, they are motivated by continual feedback and recognition for not necessarily huge achievement, but every sort of small thing that is a step forward. So they're very motivated by that feedback. And very different from baby boomers and X who think, why are they just needy? Why do I need to give you feedback? You know, why do I need to tell you thank you for coming for work? No, it's not they're being needy. It's they want you to just let them know that is what I'm doing okay? Am I doing a good job? Because actually, if you don't do that, they start to feel vulnerable. They start to question whether they're good enough. And I think we've seen a lot of people go through lack of confidence because there's been this sudden void in this constant feedback to help them to deliver. If I just go on to the next slide, I just want to talk about, because we've only got 15 minutes. So I just want to talk about the way in which for Gen Ys and Zs things are changing. What they're looking for actually is very much clear structured career development and progression pathways. Now, unlike previous generations, they're not wedded to a career or an organisation, perhaps as we once were. They are very brave. They will probably have up to 3 professional careers in a lifetime. They probably won't retire till they may never retire the way things are going. So they've got a different outlook on their career. Access to knowledge is so easy now compared to how it used to be. So if they feel that that progression and support is not being supported by their employer, they're quite brave and they'll make, real drastic career shifts. I think the other thing is they're not looking for a linear career. I started at the bottom, worked my way up, became a ward sister or whatever it was, and then eventually, I would, get a leadership role. It's kind of not like that anymore. It's very much that people are looking for a matrix of opportunities that actually they get fulfillment from. So they're really looking for sometimes looking horizontally, and this is where there's so much advantage of working in a system. Because if we could leverage all those different opportunities and share them, we could keep people in the system. It can be a career for life, but we need to open the doors to enable those changes and shifts to happen. Because actually, we can bury our head in the sand and think, well, no, we'll hang on to people and we won't do that because we don't want to lose them. But ultimately, they will go anyway, because they'll go to other industries or other places they can get that kind of matrix and change direction. They also want care and support personally and professionally from leaders and teams. They want a work family because, again, education taught them the value of a team and that everybody contributes and has a value in that team. And so, they expect that. And it's not just about the work, it's about actually what else do we do as a group that, brings that joy to the table that I talked about earlier. Feedback, guidance and developmental support I've talked about, so I won't dwell on. But the team-spirited element, coursework became a team sport for these guys. They often would submit assignments as a group. So they enjoy that kind of group problem solving and they expect to have a voice. Now, I'd ask you to question, some of the environments we work in, and I'm speaking here to executive leaders as well as other kind of types of leaders. Across the health and social care system. Do we value the voice of individuals? We still, I would suggest, are a very top-down, very much a kind of, I suppose we kind of lack that shared decision-making, that shared governance approach consistently. And that really is not a good fit with these guys. And they want to be supported and able to meet expectations of patients and public. So they want to deliver high quality. And Neil talked about this, it's not just money that drives people, it's to know you've made a difference and to do a good job. And that's why we see often with organisations that pursue excellence frameworks, their retention improves. Because actually these things go hand in hand. So to be driving quality and to be bringing the ability for staff to have a say, to lead improvement at local level actually really drives motivation. And finally, flexibility to achieve, and I've put work-life balance because I'm a baby boomer, but in my research, when I've been doing focus groups, younger generations don't always talk about work-life balance, they talk about life balance. And there's a subtle difference. How does work contribute to my life enrichment? And what we saw with Gen Y is that often if work or fatigue from work started to have an impact on that life balance, they would walk away. I think what's really interesting, what we're seeing now in Zeds, and this is kind of hot off the press, we're seeing a massive shift in behaviour. They are looking for less than full-time work at the very start of their career, so first job. I've been talking to the pharmacists recently, early career pharmacists, and they're saying to me, we'd rather work like 5-6 hour days, because these are like, these like working Monday to 9 o'clock till 6 o'clock at night really is exhausting. Why would you want to do it? And actually we're seeing this now coming to play out in the choices, in why people are leaving. So we really have to shift how we think about flexibility. And I think, in health and social care, this is a real sticky point because we've got to keep a service running. We've got to keep a service running while we're holding vacancies. So transformation is, for me, the only way forward. We have to transform, and we have to be open to know that we might have 2 or 3 people filling one whole-time equivalent vacancy, especially in early career professionals. And that's just how it is. At least we've got them. Because if we don't do it, they'll go off and be something else because they can. You know, it's quite easy now for them to change into different industries. So if I could move on, because I want to bring a bit of kind of focus on what we can do, because I don't want you to be feeling overwhelmed. So I did another piece of research after that, thinking foolishly that I have a lovely formula that said, if you do this for baby boomers, this for Gen X, this for Gen Y, and this for Gen Z, your problems would be solved. And of course, I was completely wrong. So we researched what was important to all generations, and actually what we found was, despite these nuances of what you will do if your needs aren't met, at the core, the things that are important to us all are pretty much the same. So if we go on to the next slide, I want to talk about these, and you will see this stuff repeated. Whatever research you read on retention, you will see these things playing out. So the first thing, so in narrowing the gap, which is on the right, this is the piece of work we did with all generations. And what we found was, if you've got really good supportive working conditions, your systems of governance are very reasonable, you know, you don't straitjacket people, and the pay status and security is kind of acceptable, you don't get job satisfaction. You just keep the noise down. Because job satisfaction and dissatisfaction aren't the two ends of the same continuum. What we found was, if we really wanted job satisfaction and to retain, it was the other 3 things on the right. Meaningful recognition, which go back to the 50s when I talked to you about original job satisfaction theory, to know you've got a value and to know that your contribution is being recognised. So in the work that I've been doing practically over the last couple of years, what I'd say to you is, if you do anything else and you want a quick win, go large on recognition. Use every opportunity to celebrate, award, you know, whatever it is, in whatever way. And it can be small ways at local level. But, you know, it really does. For me, that's one of the biggest catalysts in shifting the culture change, focusing on the good. And then growth and advancement. So actually what we know is, if people don't feel, and we've talked about this a lot earlier, that there's somewhere to go and there are opportunities there that satisfy their aspirations, they won't stick around. And finally, we found professional autonomy. So this helps back to that having a voice, having job control, being involved in decision making. It was front and centre in the reasons why people stay. And threaded through that was obviously flexibility. So interestingly, when I went to work for NHS England, there's so much stuff out there, isn't there, on retention? And it was kind of, how do we bring all this together and simplify it? So we did a piece of work, we did a global literature review, we did a review of every single piece of grey literature, from policy think tanks to, you know, wherever. We put it all together. And guess what? The same 7 things featured across all of the literature. So if I go on to the next slide, I'll just tell you about those things. Leadership and teamwork, that's compassionate leadership. That's leadership that focuses on shared and distributed decision making. And that links to the autonomy and shared professional decision making, finding ways to involve people in the work that they do, and devolving the improvement work to them, obviously with support. And I think I'll go back to my work, and Anne-Marie's on the call, and I worked with her a couple of years ago, and we had this focus on shared decision making, where our support workers were chairs of local, you know, decision making councils. And the scale of improvement was just phenomenal, far than I've ever seen in my 40 years with a top-down approach and a kind of, let's have these 3 priorities, you all deliver it. They were just on fire. And of course, through that, you know, talent comes out, because you see these people that you didn't even know about who suddenly are really brilliant at what they do, and great leaders, and kind of go off to do bigger and more complex things. It's just really fantastic. Professional development careers we've talked about, meaningful recognition featured again, flexible working again, health and well-being, and of course to do a good job and deliver excellence. So it's this bundle together that actually shift the culture and make the difference in terms of retaining. And of course, if you've got a good environment, a good workplace environment that retains, you will probably attract as well, because they're kind of the same thing. You know, people come because actually it's a good organisation and they hear good things about it, and their experiences with that organisation are really positive. I just want to point you to some resources. So if I could just have the next slide, please. So I've talked a lot about the why and the what, but you're all looking for solutions. So if you go onto NHS England and NHS employers' websites, there are 2 books that talk about these 7 things and give examples of what people have done. And they talk about, you know, practical examples of how, despite the challenges, and I've heard that word about 6,000 times today on this call, I think, despite the challenges, you can still do stuff, because sometimes you can feel a bit, well, what's, you know, where do we start? Can we make a difference? But from my experience of people that have kind of focused on these things, even despite, you know, the resources, the staffing, the challenges, the finance, whatever, they've still been able to turn the dial on their retention. So I just want to take us back to the beginning and actually what makes a good job. And I know you've talked a lot today about workforce redesign. So some of the emerging research that I want to share with you really is about that needing to have significance in your work and to know the impact of what you do. And we have a very, what we call tailorist approach to workforce planning in the NHS, which is where what we do is we have a very much a task focused, and we break all the complex tasks down of a job and then we redistribute them. The problem is the person that was doing that job originally then ends up not doing the job they were trained, educated and came in to do. And that has a massive impact on their job satisfaction. It also causes lots of stress and burnout, because actually they then are supervising all those other people that are doing parts of their job. So I think one of the things that I'm really focused on at the moment in the time that I have is this message that let's not shoot ourselves in the foot with workforce redesign. Let's be really careful that when we design those jobs, we still enable those people to do the job they came in to do. And there's lots of other ways we can redistribute work. But just to be mindful, and what I would suggest, the Nuffield Trust have got a really good video on this. They had a kind of conversation. Professor Alison Leary talks a lot about Taylorism and the impact, and it's really worth a watch if you're involved in redesign, because I am really anxious that we could be causing ourselves a problem with the new workforce plan in our, I guess, eagerness to address our labour market shortage. So I think final slide, and hopefully that's given you a whistle stop. You know, it's probably a day's stuff here, but hopefully it's given you a whistle stop on why all this stuff's so important and where it tracks back to. But just to know that we are competing. You know, this is a general labour market trend, not a health and social care trend. So this, you know, the great attraction or great attrition research that McKinsey did in the US just on the, as we were coming out of COVID, identified that 19 million US workers and counting were quitting their jobs. People are making drastic decisions if they're not happy. And obviously companies are struggling to know what to do about the problem. But what their research showed that actually creating a sense of belonging and feeling valued holds the key to strengthening the ties with employees, so that actually they take your organisation and your system forward for you. Okay, and I think the last slide is just my contact details, and I am exactly out of time.
Thank you, Kerry, and well done for keeping to time and for an amazing presentation. Thanks so much for taking us through that. And you know, I think for me the really poignant bits were about you know, 3 people potentially filling 1 vacancy. I mean, I can just imagine the reaction for some of our ward managers if we were to say that, and it links to the flexible working conversation, the rota management bit, and that we do need to think really differently about the way we retain people based on what they need rather than what we need. So that, I think, is something that's coming out as a theme from today. So thank you so much for that. So now we're going to go back into our breakouts again. So we have one breakout on culture and compassion, which I think follows really well from the conversation that we've just been party to. That's going to be led by Paul Draycott and Pauline as well. And for the next one, it's the attracting new communities to work in health and care. So that brings us forward from the conversation we've had this morning. So what I'm going to ask, as per this morning, is that we move into our breakouts, which is a different invite. You should have it all in your inboxes, and we'll be back on this link later on. Thanks very much.
Have you got another link? I haven't.
Got any links?
No.
There's nothing in my. No.
With I'll speak to them.
Hello, everyone. I will paste the links into the chat now. For those of you who don't have them. So there's 2 links. Please choose which session you'd like to attend.
Thank you so much.
Thanks, John.
Rachel, I just wondered which breakout you're going to.
I haven't actually received anything, so I don't know whether I'm needed actually in a breakout room because I facilitated this morning.
I'll go to the new communities one thing. Will you go to the compassionate care one?
I will, yeah. I'll just wait and see if a link comes through. I've not received anything as of yet.
Just in the chat there, Rachel.
Right, thank you. Princess. Quiet to meeting.
Hi everyone, welcome back. I'm conscious that some of the breakouts are just finishing off. So I'm going to wait a little minute or so to make sure we have everyone back. I'm just going to be watching those numbers increase. The technology of doing this virtually, I think we've done okay so far, but at any point it could all go wrong, so don't get too comfortable. I think we've done okay, but actually, and thank you so much to all of our tech colleagues, because honestly, it's been a challenge, the breakouts and the breakouts from the breakouts, and then the main room, and then back. So you've all done amazing as well, for coming back as well. So thank you. Thank you. Right, so there's 70, but we were at over 100. So I'm conscious we've got Peter here to talk to us. And I'm tempted to start because of time, but then I also want everyone to have the benefit of hearing what Peter's got to say. So I'm going to wait for a minute. I'm sorry, I am going to wait because we're missing a massive chunk of people.
That's absolutely fine, Mish, not a problem.
I'm going to just send a message to my team asking everyone to actually come. I feel a bit like a parent saying, come in now, your dinner's ready.
Oh, you're giving us food as well. Fantastic.
Virtually. It's a virtual cake. There you go.
Thanks.
You know what? We were having a bit of a chuckle earlier about bounty bars, Peter. And I know that you like a bounty. And one of our speakers said that apparently, you know, that one of the best ways to welcome someone into work is to give them their favorite chocolate bar, and showed a picture of all the different chocolate bars and said, but of course, if it's a bounty, then that's a problem. And I thought, well, I love a bounty, you love a bounty. And it actually sparked quite a debate in the chat.
Well, there you go.
Why people don't like them. They're amazing.
Well, actually, I've actually got a mini Snickers next to me, which is very, very enticing. And then I realised it was coming up to 1:15, so I haven't been able to eat it yet. So I'm going to talk when everyone's here. I'm going to talk incredibly quickly. So.
Oh dear. I love a Snickers as well. Just FYI for everyone on the call. Sharing is caring. Right, we're up to 90 now, Peter, so I suggest you start. I think there's still a bit of confusion. There's some of the calls starting, so just ignore all that. We're here. Thank you very much for joining us.
Okay, super. Right. So good afternoon, folks. So Mish has asked me to say a few words, and I haven't been here for the whole day, but have been for the last few sessions. So I've kind of got some insight into the quality of the conversation that I'm sure you've had for the whole of the day. I've written a number of things down, and in no particular order, in terms of reflections. The first thing I'll say is, look, a huge thank you to everybody that's been involved in pulling today together. I probably won't get the chance to say that before the end, so I'll take it now. So Mish, the team, but particular thanks, of course, to you all for participating in this, because, of course, it'd be nothing without all of the contributions that you've made. So, as I say, from the outset, a huge thank you. First thing I noted down was just to reflect on the complexity of the agenda that we're trying to deal with here. This is another one of those wicked issues and challenges that we in the NHS have a number of, frankly, don't we? You know, we're trying to deal with a whole host of wicked issues, but for me, this kind of event and the broader conversations, you know, that we had a moment ago in the culture session breakout session that I was in, all go to the fundamental purpose that why ICSs were created in the first place. You know, their fundamental role is to move away from competition to a more collaborative state. So acknowledging that we do have a really complex, challenging agenda in front of us, you know, we're in a great position, in a great place, whether that be national policy in terms of the creation of ICSs, or, and I would say this as Chief Exec of the ICB, wouldn't I, or what we've done over the last year or so, and beyond that, of course, in terms of the people agenda, to create the building blocks, the foundations that we've now got. I personally think the challenge from here on in is to utilise the tools, things like our operating model, so our place provider collaboratives and portfolios. So the things that we've developed as a collective, I think the challenge now is to use those to deliver improvement for the population, to deliver, of course, on the workforce agenda, ensuring that we support our people in the system in the best possible way we can. So that was the first point from me in terms of the complexity, but the opportunity that we've got given what we've done over the last year or so. The second point I noted down was importance of leadership, and I'm sure that's come up again and again and again throughout the day. A number of years ago, I was taken by an NHS Leadership Academy leadership model that's got 3 words to it, but part of it has been used today to spark discussion and debate. But those 3 words are inclusivity, compassion and effectiveness. And it was a number of years ago now, I think the Leadership Academy described and rolled that model out as a really clever, because it's concise, isn't it? It's just 3 words, really clever way of describing what good leadership is. Now, we've debated the compassion bit a moment ago in the breakout room, and some great ideas came through. For me, inclusivity is also absolutely hugely important, because without inclusivity, in my mind, inclusivity is about bringing folk together to make more effective decisions than if we make decisions in isolation. And we're only going to solve the challenges that we've got in front of us if we are more inclusive in decision making. So I love the way that, as I say, the 3 words that define what good leadership is, but there's something about making sure that we do that day in, day out. We support each other, we treat each other with respect, dignity, etc., etc., and we absolutely, are inclusive in the way that we make effective decisions. And the other bit that I've written down, which is obvious on one level, but there's something sometimes about you've got to say these things to make them obvious, is about perspective. And too often, I think in the NHS, and I'm sure in industry more generally, we will look at the workforce challenge from our lens, our perspective, and build solutions orientated around what we think is the answer. Now, of course, what we're trying to achieve is attracting individuals, attracting people into our working environment. And so obviously there needs to be a focus on their perspective. And we know that perspective of, for example, Generation Y, it's a widely sort of studied sort of area, is quite different to perspectives of previous generations. So that flexibility of working, that ability to give people time outside of work to be able to fill their own personal ambitions is hugely important to that generation. So how do we tap in to that perspective and build attractive working arrangements, environments, packages for that group of individuals? So there's just something fundamentally for me about perspective, and it being hugely important that we look at it from the lens of those that we wish to attract, as opposed to what occasionally we risk as being quite a traditional lens that we look at things through. And the other question I've written down is, from here, what next? And I'm sure Mish and the team will come on to that, but this is a massively important agenda, and that's one of the reasons, of course, that this is on today. But it's also a massively exciting time in terms of the opportunity that we've got, and I articulated some of that stuff earlier in terms of our operating model and what the ICS is all about. So the question fundamentally for me is, from here, what next? How do we make sure that we augment the things that we're doing in such a way that do make it better, do improve our recruitment, do improve our retention, do improve our working environment for us all and those that would come in, but do it in such a way that we don't overdo it, i.e. we don't try and do too much too quickly and we end up doing everything not very well. So for me, what are the key things that we want to do next that will enhance our effectiveness in this regard? But let's not pick too many things and, as I say, skim them all and do them all pretty poorly. So what are the few things that we feel we can do next that will help? Mish, I'm gonna stop there if that's okay. In no particular order were those thoughts, but hopefully at least they sort of came together in some semblance of common sense and as I say, made sense to folks. But thank you for the opportunity to input.
Thank you, Peter, for coming. I think people really appreciate how busy you are and your time, and the fact that you obviously really do understand. It's really interesting, some of the stuff you said is the things that we've been saying throughout the day. So what are the few things? Let's not try and eat the elephant whole. Let's try and really focus down on the things that we can do collaboratively at system level. And then we'll be considering, of course, at organisational level, what we can and should be doing. In terms of next steps, we have heard a lot from the breakout group. So what I'm going to do now is hand over to Gemma and Martine and Pauline to talk about the feedback from the workshops, and then we can start to distill some of that in terms of the next steps and what are our actual aims that we're going to go for over the next 6 to 12 months. Thank you, ladies.
Thanks, Mish, and thanks everyone. I'm just looking actually at the Jamboards and some of the chat and some of the notes that I've written down, and there's so much I couldn't actually see. I couldn't pick out some of the key points from the trainee pipeline discussion was huge. The Jamboard's huge, so I'll just go through a few of mine, and then I'll hand over to Martine and Pauline, and then I'll get Chloe, if that's okay, towards the end, if you can give us a bit of an update on that illustration, and Esme as well. And then what I'd like to just start off with, though, is if you can all start to think about, and hopefully this has been mentioned in your breakouts, is your people pledge. So really kind of thinking about what you'll take away from today. It could be one word, it could be multiple words, a kind of commitment almost to what you're going to take away from today as an individual within your teams, or as a, an ICS partner in kind of solving this conundrum, solving all of these conundrums that we've discussed today. So with that in mind then, so from a trainee session perspective, as I say, lots and lots on there, and we know that this is a discussion that we've been having in various different groups, but just some of the key points from that particular breakout was looking at holistic ICS career pathways in health and social care, so really looking at the breadth and depth of those pathways. Student experience was a really big one, and the basics, so including students in the workforce and getting the basics right from the beginning, and retention within that as well. The whole placement experience and capacity was a massive area that was covered in all of the sessions. Agility in terms of the courses, in terms of what we're offering, our placements, our models, attracting people locally. So I think we've talked about throughout the session, kind of keeping people within our local community. People come to study here, but how do we then keep them here? Volunteer pipeline was mentioned as well, and how we provide some work experience as well within volunteering to help enable people to get into that pipeline. So lots, far too much to mention in this short section, but we will be capturing some of this and feeding it back to you all. So I'm going to hand over to Martine, if that's okay, to just update on the Flex Conundrum breakout.
Yeah. So during our breakout session, we did share some real life examples of where flexible working or that flexible offer is actually working. And I think the attendees of that session found that really useful. I think we all know that we've got to embrace flexible working. It's not going anywhere. We know that that's what our future workforce is demanding of us. But I think in the session, we talked a lot about how really fearful managers are. So our ward managers, our team leaders are really scared. They don't know how to balance the needs of the workforce with patient care, and actually seeing how we can make a flexible roster work is really difficult. So I think a takeaway for us is how we can provide managers and leaders with those resources that they need to show them how it can work. And I think as leaders, we all need to be promoting the fact that we can work differently. It is possible, and together, there's so much that we can do. So there was a real appetite for collaboration in that session as well. So we were it felt like we really ran out of time really quickly, but we'll definitely continue the conversation. And we've already got a flexible working group through our retention programme, but we will invite more people to come and join us in that so we can carry that conversation on.
Thanks, Martine. And just to mention, actually, Martine's mentioned about a follow-up. We've got a 9th of November face-to-face event that we'd kind of arranged as a bit of a follow-up for this event on some really key issues that we wanted to delve further into, and then invite partners along. So we will be getting in touch about that event as well. Pauline, if I can invite you in to give us an update on the culture breakout, if that's okay.
Yeah, thanks, Gemma. We talked a lot about the work of Michael West, and the fact that it's been around, I think, gosh, over 20 years or so. And actually, we'd not really made as much progress as we would have liked. And what's stopping us? It's kind of within our gift, isn't it, to try and do something about that. So we talked about that a little bit. We also talked about, in terms of our leadership development, needing to have a really, really firm foundation for our leadership development efforts that was very much based on our leadership compact, and that really sort of set the expectations of what we expected of our leaders, but also allowed us to be able to measure that development of our leadership behaviours as well. And also being aware of any assumptions that we might be making about our leaders. So, we can see people in particular roles or performing a particular role and actually make assumptions about the level of capability or the level of training they may have had. So not to make assumptions around that, and really think about how we have a good, clear pathway to develop our leaders, wherever they might be, and just being more mindful about that level of readiness. We talked a lot about relationship building, the importance of that, and also understanding the importance of building trust and confidence in each other, and the important role that plays in some of the things that we're trying to achieve. And also thinking about, if we do actually want to be more compassionate as a system, what are the behaviours that we're rewarding? Are we rewarding compassionate behaviour? So that's something I think really, really key to think about. And also, we talked, some of these things are coming from the other rooms. Think about what our starting point is. Nobody comes to work to do a bad job. And actually, that's at the essence of compassionate leadership, isn't it? So just thinking about how we meet every individual where they are, I think. And we also talked a little bit about collaboration and how we can do that better. And actually, we know that we can, because, we've got some really, really good evidence from the High Potential Scheme about how we've come together across the system to roll that programme out very, very successfully. So, how do we build on that and think about how we can better mobilise our talent across the system and start to put our best people in positions to help us collectively start to solve some of the wicked problems that we have. And the note I'd like to end on, which I really, really like, is how do we keep people happy by being good leaders? Because that's what comes down to it, really, isn't it? We want to make sure we've got a happy and looked after workforce. So how do we keep people happy by being good leaders?
Brilliant. Thank you so much, Pauline. And then finally from me, I was in the attracting new communities to health and social care. And again, really good input from all of those breakouts. And I think there's definitely some themes that are cutting across all of these workshops, because leadership was mentioned in that in the attraction session as well, and how we're preparing leaders for attraction and then kind of retaining people as they come in. Some of the key things we talked about was, the advertising and our application process, and making that as easy and accessible as possible to all of our different communities and different groups. We talked about who we're reaching and how we're reaching, and that kind of employment and value offer. Talked about things like childcare, which was mentioned earlier, and things like unemployment and how we're attracting people in who are unemployed, where the benefits potentially that they're receiving outweigh what we can offer them as an employer. So how do we attract people in and help them to stay as well? Again, building on things that we are already doing as a system and collectively, but coming out loud and clear is the attraction of young people and how we're getting into the schools, the colleges, from a young age, and talking to people, young people in schools about the different careers, and linking that with health and care, and prevention messaging as well in the classroom. Something else was, the attraction of students from college and from university into our system, and again thinking about different ways in which we might incentivise, or we might help people to come in and that be easier for them. So things like guaranteed interviews. Collaboration and partnership working was a key theme again throughout, and different enablers as well in terms of attracting people. So we've got to have the foundations, we've got to have the infrastructure to help attract people and keep them, and different ideas around how we might reach different seldom heard communities as well in particular, and going further in terms of how we're accessing those different communities, and representing those communities in our workforce. So one of our group mentioned about referring a friend, and individuals that are working within our system currently, how do we help them to bring those different communities in? So lots of discussion, lots of solutions, lots of suggestions about how we might take these particularly challenging areas forward. So the team, we've captured everything in either Jamboard, the chat, we've recorded everything, people have made notes, and we're going to consolidate all of that. And the good thing, as Mish mentioned at the beginning, is we've got the infrastructure, and we've got the kind of the kind of working group structure to take some of this, well, to take all of this work forward. So the next steps will be us just kind of consolidating everything and making sure it goes into the right groups and we're bringing the right people in. So if you're not involved in this work and you would like to be, then please do drop us a note in the chat. So just going to bring Chloe in at this point, if that's okay. Chloe, are you okay to share your screen again?
Yeah, can you hear me?
Yeah, got you, Chloe.
Yeah,
thank you.
Brilliant. 1 second, I'll just get it up now then for you.
So for those starting to share now, thanks Chloe. So for those who weren't here this morning, Chloe and her colleague Esme were here providing us with some live illustration throughout the day, just to kind of capture what we were talking about, some of the key challenges. So yeah, over to you, Chloe. Thank you.
No problem. So yeah, this is one of the second ones from the day. So I'll just let this play out on the time lapse for you.
There's a lot of love in the chat here, Chloe, for these, and I'm guessing
brilliant.
I'm guessing that that's nearly Eastwood in the mustard section there.
Yeah. Trying to get the personalisation in there as well.
Fantastic.
So that's that one, and then I'll just go back through, and then we've got the final one here of the aiming higher, so you can just have a quick look at that one. That one's not finished just yet, but we'll be going back in and obviously finishing all these off for you. And then we've just got a last one from Esme, which she did on the breakout room. Let me go back into that one. It's not loading. She's had to send me this over, so it's not coming through. But that one is finished, but you can only see the train. Sorry about that.
No, that's fine. These are looking brilliant, and I think really capturing the day. So thank you so much to you and Esme, and we're going to be lots of cheers there from everyone. Yeah, so thank you so much.
Thanks.
So we'll be. Yeah, thanks again to both of you. We're going to be sharing these out after today, so fantastic. Okay, great. So I think if we can just share the slides again, I think we're going to ask you a Slido question, and then I'm going to hand over to Showcat. Brilliant. Okay, just coming up now. Thank you. Okay, so as with before, so we're going to ask you the same question again, and it isn't a trick question, and you can answer the same if you think it's the same. If you think it's the same answer. So for those who've not used Slido before, if you use your mobile phone, just scan that QR code with your camera. And so how well do you think we already collaborate as a system on workforce issues? So this morning, around 47%, which was the highest, voted 2, which was 1 being the lowest, 5 being the highest. And that was okay, because we know that there's further work to be done in collaborating. So we're already a little bit higher just from today's event, which is fantastic. Maybe a leading question, but I think it's good to show that we've collaborated today. Okay, so I think that's fairly static there, and 50% are saying around 3, just over 50% are scoring us around 3. So we've improved from this morning, and I think the message is that we want to continue to improve and collaborate further. So yeah, thank you everyone, brilliant. Okay, so I'm going to hand over now then to Showcat, who's going to provide our closing remarks.
Thanks, Gemma. So
thanks, Showcat.
I just want to make a few observations, and first and foremost, a huge thanks for the way everyone has come together to be part of this summit. I know the intention was to do it face to face, and I think the right decision was taken to do this online instead, bearing in mind where we are today in terms of industrial action. But it's fantastic to see the sheer number of people who participated. So a number of observations from me, and the first and foremost, I suppose, is recognizing the importance of the workforce, because I think we all know that you can have the best systems in the world, you can have the most brilliant processes, but the reality is, if you haven't got the people sitting behind those, then actually the reality is you can't make any of those work. And certainly I've seen from my own experience that it doesn't matter how good the processes are, you need really good people to be able to manage those particular processes. And I think the system-wide working, as Peter already said, it presents us with a number of opportunities. So in particular from around collaboration, agility and inclusivity. And it was really good to see some of the workshops focusing on those particular areas and how we move forward. But for me, there is something we probably need to recognize from an organizational transformation perspective, how the world has changed, and in particular in a post-pandemic world, nothing will ever be the same again. And in particular, where people are, how they view the world of work and how they want to work. We know that career ladders have been replaced by tours of duty, where people aren't as obsessive as they were about following a particular career ladder, that they will take a particular role, be more than willing to move on, won't want to work 5 days a week or 37 hours in terms of the standard required. And what that means is we need to do a particular amount of organizational redesign about how we move forward. So there's got to be some recognition of that. We also know that hierarchies are being replaced by networks, and the importance of networks is key, and it's important we move away from those hierarchies, which can be very difficult in the system and structures that we have within the public sector, and particularly in terms of our governance, our management against risk. It can be really, really difficult. The other thing for me from an organizational transformation point of view is moving from planning to experimentation or innovation. We know in terms of the size and scale of the budget challenges, the demand pressures that we face, we've got to innovate. We've got to be able to redesign services in a way that we've never done before. And then looking at those hierarchies is how we move from a controlling environment to an empowering environment. And I was really taken by the comments about the managerial role. And in particular, it's that bit about how we empower our managers, because a manager today, the whole minefield about what an employee can and can't do, and how an employee can almost decide about how they want to work, and trying to balance that against the needs of the patient, the resident, the customer, the tenant, it can be an absolute minefield. And I think that at times puts managers on the back foot, because they just don't know what to say and when to say it, or what they can or can't do, or how procedures work or don't work. So it's really challenging when you're a manager, both in terms of managing services and managing people and managing budgets alongside that. So that work around leadership development, about empowering managers, supporting managers, is critical and key. And the HR and OD community and the resources that all of you provide are got to be essential to that. And middle managers in particular will look at senior managers to be that light, to be that guidance, to help not just support them on their direction, but also provide the resources going forward. So we know we're in a hugely challenging area about how we move forward. I think the summit today is the start of a conversation. And, as Gemma has said, there's been lots of information given. I think what's key and what's important is how we sustain the momentum, continue this conversation, and certainly through the Culture and Organisational Development Committee, we'll make sure we do our bit against that, and how we turn some of the ideas, the thoughts from today into real actions, how every colleague around the table, the virtual table today, can help and support that and be part of that activity, and how we make sure we involve the whole system. So for me, it's closing for today, but actually I'm hoping it's the beginning of a conversation that we will work our way through, and certainly at board level, some of the feedback will be shared. And I just want to finally say thank you to everyone who's contributed and participated. This is such a key area and a key topic, and it's great to see the level of enthusiasm and energy in the room, and how people have embraced this work. Thank you.
Thank you, Showkat. And wow, what a day. We've managed to do it virtually. And I think we've had some amazing contributions. Everyone's been so engaged. And I think we've got some really good stuff to go on to hone down. And what we're going to do is we'll share all the slides, all the feedback, all the illustrations with you. You'll be able to use them in your own spheres, in your own organisations. What we will then do is to hone down on the outcomes for us. Some of it might be actually meeting together face to face. For example, in the flexible working conversation, what we'll probably need is those inspirational colleagues who have done this. They've actually managed to solve the conundrum in a ward-based team. So getting Tracy to come and talk to wider groups of managers, to think about that leadership challenge, actually how do we kind of make people feel braver in order to take some of these risks, as Showkat was just saying about actually going into the unknown. So yes, we might have some face-to-face, we might have some more webinar virtual sessions, but what we're doing from today is, as I said right at the start, we have looked at the workforce plan. We know how many staff we need in the next 5 years, and we know the areas that we need to focus on. So this will be our people plan, this will be our response to the long-term plan, and we'll continue to engage with you on all of that. If we just take the slides down, Di, please. What I'm going to ask now, because I have the wonderful job of saying thank you to everyone, I would really like everyone, please, to come on camera that's been part of today. And it has not just been, I can tell you now, it hasn't been me at all. I've done hardly anything to support today. It's been a labour of love over months. The team and actually the collaboration we have had from all of our colleagues across the system. So all of the partners have been involved in preparing information for today, to facilitating the workshops, to pulling data together, to doing infographics. Our illustrators have been amazing. I'm sure you'll all agree. So actually, I just want to say a true thank you very much for everything. These events don't just happen by themselves. And actually, I think what we've managed to do is it hasn't just been a talking shop. We've managed for this to be business-like. We are going to take our actions from this, and it's been a massive amount of hard work. And I'm just going to unashamedly check my notes to make sure that I haven't missed anyone out. I don't think I have, in terms of everyone that's spoken today, but can I just ask everyone to turn their cameras off apart from Alex Brett? Now, she's going to absolutely kill me for this. But I just wanted to say, with everyone together, there has been a change in terms of the senior leadership at ICS level. She's going to kill me. Look at her face. Just in terms of myself acting into the CPO role. And the reason for that is that Alex, who's led our team for the last 5 years, is now going back to MPFT. And I am personally devastated about that. The support I've had from Alex, the leadership, she is honestly my mentor, and she's an inspiration to me. She's amazing at the workforce stuff and also the cultural, and because she's from a clinical background as well, the amount that she's added in terms of bringing and facilitating and helping us to lead the way with collaboration has been massive over the last 5 years. And I just wanted to take the opportunity to say thank you so much for that. We can't let you go without embarrassing you. Shajida had it at every meeting, and you've only got the one, Alex, so be happy about that. But thank you for everything. And I know we'll continue to work so closely together over the next however many years. So yes, I just wanted to say that here. And if you would like to say anything, you can.
Just to say I'll pay you later. Thank you, Mish. And thank you, everybody, for a great day. It's been brilliant. But thank you. I won't say any more. You've embarrassed me enough.
She's going to kill me.
I'll take my red face away now.
But yes, absolutely. So thank you so much, everyone. Really appreciate all of your time. We finished 7 minutes early. So you are very welcome for those 7 minutes back of your day. But thank you, and we'll be in touch. So really appreciate it.
Thank you. Bye.
Bye. Bye, everyone.
Bye.
Thank you.
Bye, everyone.
Thanks, everyone.
Bye.
Thanks, everyone.
Bye. Bye.
Bye. Well done.